Now that the COVID-19 vaccines have been out for some time, many people are starting to get their second dose. What side effects are normal? What side effects are you more likely to experience? And when should you be concerned? The COVID-19 vaccines have been out for quite some time now. Many people in different places in the world have started getting their second doses. There's a viewer comment that really caught my attention that I'd like to address, and I'd like to clarify some things in regards to side effects from the COVID-19 vaccines, in particular the second dose. First, let's go over the data that we have to date on adverse effects following immunization. This is a reporting system that happens with all medications and vaccines. This is the report that you are able to access yourself, and I will give you the QR code to access that. This is the latest data that we have available, and this will lead into a broader conversation that will include the global audience regarding some of the side effects that may be more common or more concerning, and I'll give you some guidance on how to deal with that. All right, so COVID-19 vaccine side effect update, when to be concerned. First, we're going to look at some information from Health Canada. This is going to be very brief, so if you don't live in Canada, just hold on. We'll go over this really quickly for you. So as of June 25th, the evidence that we have to date, or the data that we have to date about adverse events following immunizations, this is otherwise known as AFI reports, identifies that there have been no new safety signals that have been identified in Canada. However, this continues to be monitored. There have been over 34 million vaccine doses administered in Canada. Total adverse events following immunization, reports that were non-serious, 6,686. Reports that were considered to be serious, 1,884, which is 0.005% of all doses administered. Now, these are still being investigated, and it doesn't mean that these are serious events that were necessarily tied to the vaccine, although they could have been. Some of these events do refer to anaphylaxis or an allergic reaction from the vaccines. Anyone who reports any type of serious event following immunization, this gets reported. Pharmacists, doctors, nurses, these all get reported into Health Canada's pharmacovigilance website here, and then they are investigated. And so these are the number of reports. This does not mean that all of these were necessarily pertaining to the vaccine, but they were associated time-wise with the vaccine, and so they do warrant investigation. This is accessible to anyone, and you can look this up for yourself. There should be a new one coming out every week, and you can look at all of the different information on adverse effects following immunization. And I'll go over a few of those in more detail later on. So as a pharmacist, we always talk to people about side effects from any kind of medication, therapy, or vaccination. Side effects often can happen more frequently with the second dose of a vaccine, and they can be more severe. But when should you be concerned? I recently received a comment in one of the descriptions of my videos regarding the second dose of COVID-19 vaccine. I'd like to share this comment with you and then go over some of the data that we have to date in regards to side effects from the COVID-19 vaccines. All right, so my viewer comment here, my 76-year-old mom got Moderna, but second dose she had a bad reaction with a swollen left arm. The whole arm. She had to go to emergency. The hospital says it's Moderna cancer. Checked on her yesterday and still swollen. It's been over 2 weeks. Well, I'm sorry to hear that. It sounds like your mom has had a really hard time, and it also sounds like she wasn't treated very well at the hospital. And so this is really unfortunate. So the fact that anyone would make a comment like this, even in jest, is completely outrageous. But if you do get a hypersensitivity reaction or some swelling, should you be concerned? Before we discuss that further, let's go back to the incidence of side effects with the different vaccines from Health Canada. So you can see in the light, I guess it's a lilac shade, non-serious events that have been reported, and this is by vaccine type. So you can see Pfizer's, then Moderna, then the Covishield and AstraZeneca. I'm not sure what unknown pertains to. It might be Johnson & Johnson. I'm not really sure, or maybe there's just not clarity on that yet. And then the darker shade of purple is what pertains to what we would call serious reports. And again, these are reports. Anyone can report these as being serious or not serious, and then they are analyzed by Health Canada. So this is the data that Health Canada has to date. What is a serious adverse event? So according to Health Canada, an event is considered serious if it results in death, is life-threatening, requires inpatient hospitalization or prolongation of existing hospitalization. Often this does happen with anaphylaxis. So anyone who has anaphylaxis, say at a vaccine clinic or at a pharmacy, will be sent to the hospital for monitoring. And so that would be a case of anaphylaxis would definitely fit into a serious adverse event category, as I stated earlier. Results in persistent or significant disability or incapacity, or results in congenital anomaly or birth defect. Now, this is not specific to the COVID-19 vaccines. All vaccines and therapies in Canada are monitored by this criteria. And so, but I wanted to give that clarification for you because often we wonder, well, what is serious and what is not serious?
Now, there is a small study that I was able to find, and this study highlights the Moderna vaccine in particular as causing this type of hypersensitivity reaction. I'm going to go over that with you. However, as I was doing my research this week, I also consulted with a hospital pharmacist as well as an infectious diseases physician, and both of them said that in their practices, they have seen this happen with both the Pfizer and the Moderna vaccine.
So what is COVID arm? So this viewer comment is pertaining to what I am guessing would be a situation that we also know as COVID arm or a delayed hypersensitivity reaction. So here's a study from May of 2021, and it was titled 7 New Findings About Moderna Arm Rashes. Now, I will remind you that I've spoken with clinicians and they are seeing this equally as common as being with Pfizer and Moderna. But this study from back in May was specifically looking at Moderna. I will also tell you that I've had the Moderna vaccine and I did not have this reaction. Researchers examined 16 patients who experienced red and itchy blotches on their arms after receiving the COVID-19 vaccine. The patients, whose ages ranged from 25 to 89, were referred to this research center from January 20th through February 12th. So let's see what they found. They emphasized the fact that such reactions are rare, citing the clinical trial that led to the vaccine's emergency approval, in which 312 cases were reported out of 30,000 participants. So it is fairly rare, but it is happening. In their report, they found that of the 16 patients, 13 were women. So they are finding that in this case, women seemed more vulnerable than men to hypersensitivity reactions to vaccines. I'm not sure if that's in general or if that's just specific here, but they are stating it, and they're saying that they're also more likely to report side effects to physicians. And that is part of the possible bias in vaccine adverse effect reports, is that women seem to be more likely to report things as far as side effects than men. What else did they find out? None of the reactions arose at the time of vaccination. The skin reaction appeared anywhere from 2 to 12 days after the first Moderna shot, with a median latency to onset of 7 days. So average onset being about 7 days. The arm reaction lasted for about 5 days, but could persist up to 21 days. So with this viewer comment at the 2-week mark, this was still the case and the patient's arm was still quite swollen. So that's still within the window that we are seeing here. Most people who had a skin reaction after the first shot also had a reaction after the second, typically around 2 days after the injection. So depending on the severity of the reaction, your physician or your pharmacist can deem whether it's appropriate for you to have a second dose. In most cases, they still do recommend the second dose, but best to check with your healthcare provider. Treatments such as topical steroids, oral antihistamines, and a cool compress can help, but of course you want to talk to your healthcare provider about that and be assessed first. No serious events tied to this reaction were observed, so they did not notice that the patients who had this reaction also had other severe reactions related to the vaccines, so that's good. And no such arm reactions were observed in individuals receiving the Pfizer vaccine at this point in time within the group of patients that they examined. It's not known why Moderna vaccinations are tied to these side effects, but I will tell you and remind you that this is also being seen with the Pfizer vaccine as well.
Most of us have experienced swollen lymph nodes at some point in time. Maybe you have had a terrible viral illness or an infection, and you will notice that the glands either in your throat, usually or under your arm, sometimes in the growing area, become enlarged and sometimes painful to the touch. This seems to be happening more often with the mRNA vaccines. How long should this last for, and when should you be concerned? I'm going to give you some guidance on that. And for patients who maybe have had cancer in the past or maybe recovering from cancer, I'll give you a couple of tips as to what you can do if you are going in for your vaccine to prevent this from being more of a concern than it needs to be.
This is the adverse effects following immunizations report from Health Canada. And you'll see, I think it's about 3-4 bars up from the bottom, they're listing adenopathy and lymphadenopathy. So swollen lymph nodes or swollen lymph glands. And that is how often that those are being reported. So I would say that it's pretty significant. I know this slide is a little bit tricky to read. So vaccination site pain is up at the top there, as well as headache, itching, fatigue, nausea, swelling of the vaccination site. So way down there, you do see that some people are reporting that they are having swelling of the lymph nodes. Unilateral, so one-sided lymphadenopathy is a known side effect of vaccines. It is rarely reported with vaccines such as the BCG vaccine, influenza, and human papilloma virus vaccines. However, it is sometimes reported. Pfizer, BioNTech, and Moderna, which both have higher reported rates of axillary swelling, so under the arm, compared to prior vaccines, this may be due to a higher immunogenic response to these mRNA vaccines. So what they're saying here is this reactogenicity, or these side effects from the vaccine, may be associated with the high efficacy rates that we see with the vaccine. So if you take the example of influenza vaccine, I've never seen a patient who gets swollen lymph nodes or swollen lymph glands from the influenza vaccine. But we know that the influenza vaccine in its best years is only about 50 to 60% effective. Most years it's about 40 to 60% effective. Whereas with the mRNA vaccines, we're seeing 94, 95% efficacy. So whether that is a factor remains to be seen, but I would say that it's quite possible. It's stimulating the immune system, and those lymph nodes are waking up and starting to create antibodies to this spike protein. So in the clinical trials, they noticed that in the Moderna trials, they noticed swelling or tenderness was reported in 11.6% of patients. 5% had swelling in their lymph nodes in the placebo group. So even people who did not have the vaccine, they were probably just given a salt water or saline solution after dose 1. And 16%, 4.3% in the placebo group after dose 2. In the Pfizer group, they reported it a little bit differently, but reports from dose 1 through 30 days after dose 2 were imbalanced, with notably more cases in the Pfizer-BioNTech group, 64, versus the placebo group, 6. So this was reported in the clinical trials. It was noted, and it's something that did not cause concern, but it definitely is happening more often than in the placebo group. So in these cases, lymphadenopathy occurred in the arm and neck within 2 to 4 days of vaccination and lasted for an average of about 10 days. The true incidence of post-vaccination lymphadenopathy may be higher given axillary swelling was only reported as an unsolicited adverse event. So people had to add this to their report. This was not something that they asked about specifically. So the incidence of this swelling may be actually higher than we think, because often these lymph nodes will become swollen. However, the person may not notice that they're actually swollen. How do we know this? Because we are seeing this in imaging scans, like mammograms. Let's talk about that. So when you get your COVID-19 vaccine in British Columbia, the BC Centre for Disease Control gives you this Aftercare pamphlet. And so you can see there, the second circle on the top notes swollen lymph nodes under the armpit as being a possible side effect and something that you might expect over the next few days. And there's a link right there because it is a 2-page document that could be helpful for you for after your COVID-19 vaccine. So the recommendations that I have researched, and I will give you all of the links in the description of this video, recommendations that I was able to find. They recommend that because these lymph nodes can swell and because they have caused some alarm for people, especially people who are being assessed for possible cancer, or they find a lump and it's strange and it's post-vaccination, there are some recommendations that they have made. So schedule screening tests prior to or 4 to 6 weeks after vaccination, assuming care is not unduly delayed. So if there is an urgent reason for someone to have a screening test, then that should definitely be done. However, the clinical history, which is noted here, is also important. So if you are going for some kind of a scan or some kind of test, and the person doesn't ask for your vaccination history, I would suggest that you offer it. Let them know that you had your vaccine, your COVID-19 vaccine, on this date, especially if you're getting any kind of imaging done, like even ultrasound or MRI or a mammogram, of course. Let them know your vaccination date, what side you had your vaccination on, and then they will be able to calculate how long it's been and whether any kind of abnormality could be due to the vaccine. If there is palpable swelling, so if there is swelling that can be felt through a palpable exam, a physician could have a look at that. You could go even just to your general physician and they could have a look. If this lasts for longer than 6 weeks, then it is something that needs to be further investigated. And if this happens in a patient that has had some type of cancer before or has other disease states or other concerns with their health, a physician might want to order an ultrasound earlier just to look at the nature of the swelling and to ensure that it is or is not a lymph node and the different characteristics. So for cancer patients or those who have experienced cancer and they are getting their vaccine, this is first or second dose, really doesn't matter. Another strategy would be to administer the COVID vaccine on the side that is opposite to the primary cancer. So say you had breast cancer on your left side, maybe you want to get the vaccine on your right side and vice versa. So that's just a recommendation that they make. Observing for at least 6 weeks until resolution before referring for diagnostic imaging evaluation or biopsy of the nodes, because they do know that even though the average time I think was about 10 to 14 days for this type of swelling, maybe up to 21 days, they do say that observation for at least 6 weeks because some people will have a more robust response that will be evident in these lymph nodes or swollen lymph glands. So this is the recommendation that they have made here. In higher risk situations, they say that either a short-term imaging follow-up, like I've said, like ultrasound, can be considered, especially in patients who are high risk, so maybe have a history of cancer or history of some type of head and neck cancer, melanoma, or lymphoma. The expected duration of post-vaccination lymphadenopathy is not yet determined. So there's still a lot about this that we don't know. So we're hearing numbers like 7 days, 14 days, 21 days, maybe up to 6 weeks. But if you are a higher risk patient, there is reason for you to maybe seek out medical attention earlier if you are concerned, if it's not something that goes down within a couple of weeks. And just to wrap things up here, some symptoms to look out for. Some of the side effects of the vaccine are similar to symptoms of COVID-19. However, the vaccine, as we know, will not cause or give you COVID-19. So if you have symptoms like a sore throat, runny nose, or cough, these are not side effects of the vaccine. These could be side effects of COVID-19, and so you should seek testing if this is the case. If you experience any symptoms of COVID-19, you should get a test. If you are worried, you can contact your healthcare provider. Serious side effects after receiving the vaccine are rare, but if you develop any serious side effects like a severe allergic reaction, including hives, swelling of your face, tongue, or throat, or difficulty breathing, seek medical attention or call 911 or whatever emergency number is in your area right away and tell them that you've had a COVID-19 vaccine.
Now, some people don't experience any side effects at all, or the side effects are so minimal that they would never even really complain about them. And this is not a sign that the vaccine is not working. So if you don't experience side effects, or if your side effects are not severe, do not be concerned. The vaccine is still being effective. It is still doing its job. As outlined in the Aftercare guide, you can always take acetaminophen or ibuprofen. Speak with your pharmacist or your physician before taking these. Sometimes aspirin is also an option, but again, you should talk with your healthcare provider, and aspirin or acetylsalicylic acid should never be given to anyone under the age of 18. Also, I recently did a video about anti-inflammatories being used in pregnancy, and there is a warning from Health Canada about that, specifically from the 20th week of pregnancy forward. Another thing you could do is you could apply a wet, cool compress to your arm if it is feeling quite hot or uncomfortable, but if it gets to the point that you are becoming concerned and it does not seem to be getting better, definitely want to consult a healthcare professional about that. Well, I hope this has been helpful, and I hope that this does ease your mind as to what side effects may be more common or more concerning than others, and also how long should these side effects last. If you ever have any doubts or concerns, do not hesitate to contact your primary care provider, be that your physician or your pharmacist or someone else in your community that is taking care of your healthcare. Don't take my advice for it. All the resources for this video will be in the description, and it will help you make an educated decision about your health in regards to vaccination. Thank you so much for joining me. Take care and stay healthy. Bye-bye.